Proton pump inhibitors, commonly known as PPIs, are widely prescribed medications used to treat conditions like acid reflux and ulcers. However, their overuse and inappropriate prescription have become a growing concern in primary care. Many patients continue using PPIs longer than necessary, which can lead to adverse drug reactions and increased healthcare costs. Today, we'll explore a clinical trial that investigates how deprescribing interventions can help reduce inappropriate PPI use. Let's begin by understanding why PPIs are so prevalent and the risks associated with their misuse. Inappropriate use of PPIs is not just a minor issue, it's linked to severe adverse drug reactions, such as nutrient deficiencies, infections, and even kidney disease. These risks highlight the importance of careful prescription and regular review of medication use. In primary care settings, the challenge is to identify patients who no longer need PPIs and support them in safely discontinuing the medication. This clinical trial addresses these concerns by testing targeted interventions aimed at both patients and general practitioners. Prescribing is the process of reducing or stopping medications that may no longer be beneficial or could be harmful. It's a critical part of medication management, especially for drugs like PPIs that are often continued without reassessment. Deprescribing requires collaboration between patients and healthcare providers, ensuring that any changes are safe and supported. The goal is to minimize unnecessary medication use while maintaining patient health and comfort. Main objective of this clinical trial was to evaluate the effectiveness of a patient and general practitioner-facing intervention, reducing potentially inappropriate PPI use in primary care. Researchers wanted to know if engaging both patients and their GPs could make a significant difference compared to usual care or interventions focused only on GPs. This question is crucial for designing future strategies to optimize medication use and improve patient outcome. The trial was a pragmatic, cluster-randomized, open-label clinical study. It was conducted between November 2020 and November 2021 in 2 regions of Western France. Cluster randomization means that groups rather than individuals were assigned to different interventions. This approach helps reflect real-world practice and ensures that the findings are applicable to everyday primary care setting. Participants included adults aged 18 years or older who had used PPIs for at least 1 year. Their general practitioners were also involved in the study. In total, 34,409 patients from 683 general practices participated. This large sample size provides robust data and helps ensure that the results are reliable and relevant to a wide range of patients and healthcare providers. Study compared 3 groups: usual care, a GP-facing deprescribing intervention, and a patient and GP-facing deprescribing intervention. Usual care involves standard practice without any additional support. The GP-facing intervention provided resources and guidance to general practitioners, while the patient and GP-facing intervention included materials and support for both patients and their doctors. Patient-facing component of the intervention was designed to educate and empower patients. It included information about the risks of long-term PPI use, guidance on how to safely reduce or stop the medication, and encouragement to discuss their treatment with their GP. This approach recognizes that patients play a crucial role in managing their own health and medication use. GP-facing component provided general practitioners with tools and resources to support deprescribing. This included guidelines for identifying inappropriate PPI use, strategies for discussing medication changes with patients, and monitoring for withdrawal symptoms or recurrence of symptoms. By equipping GPs with practical support, the intervention aimed to make deprescribing a routine part of primary care. Data for the trial were collected from January to July 2025. Researchers tracked PPI use among participants, monitored changes in prescription patterns, and recorded any adverse events or challenges faced during deprescribing. This comprehensive data collection ensures that the study's findings are based on accurate and up-to-date information. The trial found that the patient and GP-facing deprescribing intervention significantly reduced PPI use at 1 year compared to usual care and the GP-facing intervention alone. Specifically, 14.9% of patients in the patient and GP-facing group reduced their PPI use, compared to 7% in the usual care group and 7.7% in the GP-facing group. These results highlight the effectiveness of engaging both patients and practitioners in the deprescribing process. Findings suggest that the effectiveness of the intervention primarily derives from the patient-facing component. When patients are informed and motivated, they are more likely to participate actively in deprescribing. This underscores the importance of patient education and involvement in medication management, especially for drugs like PPIs that are often used long-term. These results have important implications for primary care practice. They suggest that interventions targeting both patients and GPs are more effective than those focusing only on practitioners. By making deprescribing a collaborative process, healthcare systems can reduce inappropriate medication use and improve patient safety. One of the main reasons for deprescribing PPIs is the risk of adverse drug reactions. Long-term use can lead to complications such as infections, nutrient deficiencies, and kidney issues. By reducing unnecessary PPI use, patients can avoid these risks and maintain better overall health. Inappropriate PPI use also increases healthcare costs. Unnecessary prescriptions add to medication expenses and may lead to additional treatments for adverse reactions. Effective deprescribing interventions can help reduce these costs, benefiting both patients and healthcare systems. Deprescribing is not always straightforward. Patients may fear symptom recurrence or withdrawal effects, and GPs may lack time or resources to support the process. The trial's interventions address these challenges by providing clear guidance, educational materials, and ongoing support. Studies' one-year follow-up shows that deprescribing interventions can have lasting effects. Patients who successfully reduce or stop PPI use are less likely to resume unnecessary medication, and GPs become more confident in managing medication reviews. This long-term impact is crucial for sustainable healthcare improvements. Future research can build on these findings by exploring new ways to engage patients and practitioners in deprescribing. Digital tools, personalized education, and ongoing support may further enhance the effectiveness of interventions. The goal is to make safe medication management a standard part of primary care. Although this trial was conducted in France, its findings are relevant worldwide. Inappropriate PPI use is a common issue in many countries, and deprescribing interventions can be adapted to different healthcare systems. Sharing best practices and lessons learned can help improve medication safety globally. Summary: the cluster randomized clinical trial demonstrated that a patient and GP-facing deprescribing intervention significantly reduces inappropriate PPI use in primary care. The patient-facing component was especially effective, highlighting the importance of education and engagement. These results offer valuable guidance for improving medication management and patient safety. Prescribing interventions, especially those involving both patients and general practitioners, are a powerful tool for reducing inappropriate PPI use. By focusing on education, collaboration, and ongoing support, primary care providers can help patients safely manage their medications and avoid unnecessary risks. This trial's findings pave the way for more effective and sustainable medication management strategies in the future.